Have you ever thought your brow bone looked Neanderthalish? If so, you're not alone. I get so many men and women alike that feel like their brow ridge is very prominent to a point where it looks almost Neanderthalish. If that's the case, there are ways that you can address this. But why do some people have a more prominent brow ridge in the first place? I'm Dr. Sarah Saxon, double board certified facial plastic surgeon, and I'm here to talk about your brow bone today. So first, let's talk about the difference between a Homo sapien or human skull and a Neanderthal skull. Neanderthals were very evolved to handle much stronger chewing muscles, so the masseter, the temporalis. The shape of their head relative to the front of their face was a lot different. They had a smaller brain, but much bigger face. They had a more sloped forehead, a more prominent brow ridge, but their jaw was a lot bigger compared to humans. One thing that set Homo sapiens apart when they were evolving is their higher reliance on interpersonal communication. So, this is a human skull. If you notice, the humans have a much flatter brow ridge. Some people do have a little bit more prominence here, but either way, compared to Neanderthals, humans have a much flatter forehead. And what that allows is the brows to move more freely. Of course, that is before Botox came along. But having a less prominent brow ridge there allowed the brows to move up and down, allow more light to come into the eyes, and therefore they could communicate with each other a lot better. So humans had a much more social society compared to Neanderthals, and ultimately that's what people think is the reason why humans lasted and Neanderthals became extinct. I really nerd out on this stuff. Despite Neanderthals actually becoming extinct, there was some intermingling between Homo sapiens and Neanderthals. So humans have about 1 to 2% of Neanderthal DNA. And some people think that might influence the development of the brow ridge in some people. So let's go into the anatomy of the forehead. So the forehead is composed of the frontal bone here. In the center of your forehead is a pocket of air surrounded by bone called the frontal sinus. And that can be different sizes for different people. It starts to develop in childhood and continues on into young adulthood. Of course, testosterone influences the size of that sinus and the size of the bone itself and overall bone structure. So men tend to have a much more prominent brow ridge as well as a larger frontal sinus. On the side of the brow ridge here, it's more solid bone, and both men and women can have prominent bone there, but men tend to have a more prominent brow ridge. Now, there's a spectrum of even between genders of some men may not have as prominent a brow ridge versus others, and same for women. So I get patients, both men and women, that feel like their brow ridge or their whole forehead is too prominent and makes them look a little too masculine. Especially for men, they tend to come to me wanting to soften their features, especially if they're in sales or any kind of profession that they need to portray trust. What I hear from men is they just want to soften their features a little bit so they don't appear angry all the time, and allows more people to trust them a little bit more because their facial features are less harsh. Now, for women that come to me, their goal is to overall look more feminine. The techniques between the two can be a little bit different when I am softening the brow ridge between the two. Now, what does a brow bone reduction mean when I am addressing the brow bone? So typically when I'm doing a brow bone reduction, I'll make an incision either right in the hairline here or just behind the hairline. I typically bring the incision on the side of the head, just above the ear here. That allows me to have a big enough access so that I can see all the structures on the forehead, including some nerves here and here that give sensation to the forehead. But in order to get adequate access to the bone, I have to have exposure. Now, there are some surgeons out there that they say they do endoscopic brow bone reductions, but you're really limited in what you can do with that technique because of the frontal sinus here. So if you were to just burr down the bone to try to smooth it out, Because the frontal sinus is there, you'd just be left with a big hole in your forehead, which we don't want, of course. And so I do something called a type 3 cranioplasty, where I actually set the outer layer of bone back into the sinus and use some titanium plates and screws. The plates and screws look a lot like these plates on this skull here, but these are for different purposes. I typically use a plate about this size, but cut it in half and use it in 2 different places. The screws that we use are very low profile, so you don't see them or feel them. And I actually use bone dust from contouring the sides to cover over those plates and screws. Now, the key that I found in getting a really nice contour to the brow ridge is to pay close attention to the orbital rim itself. It's not just setting back the bone here, it's actually contouring the entire orbital rim there, which is the edge of the eye socket. So we want to bring more light into the eyes. We want to take away some of that hooding. Now, when I am operating on a male versus a female, I'm not quite as aggressive in how much bone I remove, because it is still very natural to have a little bit of prominence in that area for a masculine face. When I'm operating on a woman, however, we want a nice smooth transition from the forehead to the nose. I want to make that as smooth as possible. However, it's not common for anyone to have a completely flat forehead. It's not just the bone there. You have muscles covering the bone that's moving the brows in different directions. And so some people may have very large muscles that will still create a little bump in that area. The only way to address that is for the muscles to shrink using Botox, which can atrophy those muscles over time. The recovery from brow bone reduction is not too bad because it's not a dependent area. So gravity will tend to bring any swelling down to the lower part of the face. Sometimes in that first 24 hours, the eyes can even swell shut. So I give you some steroids to help with that. And generally, it's one of the easier recoveries of anything that I do. It's quite surprising to most people. Now, I hope you found this informative. If you feel like you have a Neanderthal brow ridge, there are options. So if you have questions about this, definitely leave a comment below. I'm very active in the comments. You can also contact our office if you are ready to move forward with any kind of surgical procedure. I see you for a consultation and we can talk about what options are best for you. Again, I'm Dr. Sarah Saxon, double board certified facial plastic surgeon. Please don't forget to subscribe to our channel for more helpful information.